everyone who has logged on. Thank you for being a part of this and joining us today and for the last few Tuesdays and hopefully for the next 2 Tuesdays. Today we have Lori Shuart, who is supervisor at the Richmond VA, and I am personally excited to hear her because Lori was the first person who really helped bring me into the fold with KT and tell me what it was all about and show me the ropes. And so I'm eternally grateful for that. She also has a small little webinar on the AKTA's YouTube channel, which I've watched a million times. It's really good, it's interesting, and I hope that we'll have more of those. And this talk, as well as the previous ones and the future ones, will be up on akt.org. So if you'd like to watch this again, or if there's somebody that missed it that wants to check it out, it will be up there for them as well. We would like to give you continuing education credits for this. If you would log in to the chat and just say your name, that would be great. Bridget will take care of that. And we're just really excited to have Lori Shuart here. Lori, I think you're awesome, and I can't wait to be a part of this, so thank you.
Thank you so much, Kathy. You make it sound like I'm famous. Am I showing you the correct screen? It should have my title slide.
No, not yet.
Okay, let's see. How about now?
Yeah.
Okay. This is what happens when you have 3 screens and you feel like you're in mission control here. Well, thank you so much for having me. I'm very excited to speak to y'all. It's been a long time since I've been able to share with my colleagues here, and I see a lot of names popping up that I recognize throughout the year, so I'm really excited to be able to share with all of you. Again, my name is Lori Shuart. I am the supervisor here in Richmond, Virginia at the VA hospital here. Have been a practicing kinesiotherapist for about 23 years now. And have served in many capacities for the AKTA and the profession throughout the years. And I'm really excited to just kind of share a little bit of knowledge here on integrative medicine and rehab. And just to kind of put it out there, this is a 50,000 foot view of integrative medicine. There is no possible way that I could tell you everything about integrative medicine in 1 hour. So I'm just going to give you this gigantic overview of what integrative medicine is and how that integrates into rehab throughout the next couple minutes. I will be talking mighty fast because there is quite a bit of information to cover, and there's a lot of things that we can go into much greater depth about in another lecture series probably. I know a couple of these topics will be covered through this lecture series. I know Tai Chi was covered, I think, last week, and that is one of the modalities that's covered in this lecture today. So I guess my objectives is to provide you an overview of integrative medicine, talk about some different types of modalities that can be used in integrative medicine, and discuss how different components of them can be used in rehab. So here's my inspiration. Bridget Collins and I had a great discussion when we were in Mississippi together. And I had just mentioned that I had the opportunity to co-author a chapter in this book right here, Bradham's Physical Medicine and Rehab book. And I was very blessed with that opportunity to be able to do that. Chapter 18, if anybody wants to look up the book and look up chapter 18, there's actually a registered kinesiotherapist's name there, which is really kind of cool and exciting. But what a great experience for me to be able to do that. I am not a researcher by no means. I despise research, actually, just doing it myself. I appreciate it, but I don't like to do it myself. So just doing the literature review and everything to be able to write this chapter. So it was an evidence-based reference material for the field was really stretching for me, but it inspired me to be able to do this lecture for y'all today and hopefully give you some information that will enlighten you as well as clarify some points that maybe have been confusing over the last couple of years for you. And just so you know, I don't get a kickback if you buy this book. I don't get anything, believe me. I didn't get any money for contributing to this book, but this Bradham's Physical Medicine and Rehab book has been around for years and years, decades actually, and it's had many renditions. This last rendition of the 6th edition was published in 2021. So just to give you a little bit of perspective of where integrative medicine falls, integrative medicine is that crossover between conventional medicine and complementary and alternative medicine. And we'll go into a little bit more detail about what those things mean in just a moment. But then integrative health overall is that crossover between lifestyle, self-care, complementary, conventional, is kind of that everything together. That's who you are. That's what your health is all about, is integrative health. And so just being able to visualize this, I think helps some people to kind of see where integrative medicine fits in. I feel like it's becoming more mainstream than it is not, as far as conventional care goes. And so, I think the bubble will kind of start to close on each other and will be more overlapping than anything else. And then there's a lot of terms out there that I think are being used interchangeably that are worth taking a few moments to define the differences and kind of what's out there, because lots of people are getting confused. People are seeing things pop up and say, oh, I think I should be doing that. But really, it's just, the terminology is out there. So let me go through each one of these: integrative medicine, functional medicine, whole health, complementary and alternative medicine, lifestyle medicine, and holistic medicine. Kind of just define each one of those a little bit for you. Maybe this will also add some clarity for you. So integrative medicine is a healing-oriented medicine that takes into account of the whole person, including aspects of lifestyle. It emphasizes the therapeutic relationship between practitioner and patient, and is informed by evidence and makes use of all the appropriate therapies. And so I took this from the Andrew Weil Center for Integrative Medicine. Sorry, I've got a little overlap on my computer here and I can't see my words here. In the University of Arizona, which is a very prominent integrative medicine program. And basically, the way they do things is they coordinate efforts to bring conventional and complementary services together, and kind of emphasize a multimodal program or medicine practice that incorporates lifestyle changes, physical rehab, psychotherapy, complementary health approaches, and a various of combination of other things to emphasize treating the whole person versus just the disease or one particular organ. Then there's functional medicine, which again, is another system of medicine. And this particular definition was taken from the Institute of Functional Medicine. Functional medicine is a systems biology-based approach that focuses on identifying and addressing the root cause of disease. Each symptom or differential diagnosis may be one of many contributing to the individual's illnesses. For example, in this particular case, depression might be caused by different factors that may cause depression, like inflammation. And so where is that inflammation arising from? And what are the genetics around that? So the precise manifestation of each cause depends on the individual's genes, their environment, lifestyle. And so treatments generally address the genetic and biological components of the disease or symptom, to kind of treat the individual as an individual. And so it's really biology-based, functional medicine is. A lot of times there's a crossover between lifestyle medicine and functional medicine. You'll often hear that out in the field where, if you've heard of the American Lifestyle Medicine Academy. But anyway, we take into account genes, environment, lifestyle in functional medicine. Then there's the term whole health, which I think if you're working in the VA, you've probably heard the term whole health before. And that's the approach to care that supports your health and well-being. Whole health centers of what matters to you, not what is the matter with you. This means your healthcare team will let you know we'll get to know you as a person. This is why I shouldn't read. Before working with you to develop a personalized health plan based on your values, needs, and goals. And so if you work in the VA, you've probably heard whole health, the term whole health, and just finding the values, mission, aspiration, and purpose of an individual is capitalized in this process to make health decisions that are reflective of what matters most to the individual. It's not, what the practitioner's preconceived notions of what their health goals should look like. Oftentimes as clinicians, we say, well, we need to get rid of your hypertension, but that may not be that individual's particular health goal at that point. It might just be they want to get their finances under control so that they can make better decisions toward their health. And so it's just an approach to healthcare. And it gets away from that disease-centered model and focuses again on the individual and their desires. And it can incorporate conventional, complementary self-care and well-being into this whole system, not to be confused with whole person care or maybe holistic care. There's a lot of overlap there as far as the terminology. And again, I'll go through those a little bit more individually. Then there's complementary and integrative care. You may have seen the acronym CIH before. CIH stands for Complementary Integrative Healthcare. And then there's also CAM that's been out there in the world, which is complementary alternative approaches. But there's the National Center for Complementary and Integrative Health. And that's a federal government agency for scientific research on CIH approaches. And their main vision is to provide scientific evidence to the public and healthcare professionals and also policymakers, if that's appropriate at the time, to integrate complementary health approaches in a whole person health framework. And so, there's tons of research out there. And actually at the end of this, I've kind of tagged their website, the National NCCIH.nih.gov website. There's a ton of evidence-based research out there about CIH modalities and how to integrate them into practice. Then there's the terminology lifestyle medicine, which is a whole nother realm of medicine that people are using interchangeably here. While 80% or more of all healthcare spending in the United States is tied to the treatment of conditions rooted to unhealthy lifestyle choices, lifestyle medicine offers hope for the solution. And I think as kinesiotherapists, you can vouch for the fact that a lot of what we do as far as exercise, education, whatever is offering hope to solution based on lifestyle, what we teach our patients. Diseases and conditions such as hypertension, heart disease, stroke, type 2 diabetes, obesity, many forms of cancer are most commonly the root of costs for healthcare, all those chronic conditions, but they're also very preventable. To some degree. There are some genetic components, which is where functional medicine comes in, but lifestyle medicine allows us to address the root cause of the lifestyle rather than just the disease, but the lifestyle, and change that and eventually reverse the conditions or reduce the symptoms of the chronic diseases that may be occurring. Then there's the term holistic medicine. Are y'all getting tired of these different things out there yet? Sometimes this is referred to as whole person healthcare. Again, this is an attitudinal approach that an individual is a whole organism and may be affected by various aspects of influence, whether it's lifestyle, body, mind, spirit, familial, societal, different things. I think as kinesiotherapists for many years, we've always said that we treat the patient holistically, but what we mean is we treat them mind, body, spirit as a whole person. And so, using this terminology correctly and appropriately in the right setting is kind of something that we need to all engage in and use as best we can. The other thing that I think is worth exploring is the types of complementary and integrative healthcare systems that are out there. CIH incorporates practices and philosophies from whole medical systems into conventional or Western medicines. Over the centuries, there have been many different types of whole medical systems out there. Each incorporates a primary philosophy, includes diagnosis of treatment of conditions. And then here you'll see listed are some different major medical systems that are out there: traditional medicine, Ayurveda, homeopathy, naturopathy, and functional medicine. So let's take each one of these and kind of break them down a little bit more. Let's see. So traditional Chinese medicine kind of routed in the Taoist philosophy and evolved over thousands of years in China. This philosophy uses the concept of balance between the yin and the yang, and the imbalance of the two will result in disease. And so if you understand the yin and yang, and basically two forms of energy, the positive and the negative energy, if those are not in balance, disease and other illnesses can happen. A lot of times the treatments include herbal prescriptions, acupuncture, massage, exercise, dietary modifications, and meditation. Those are not the only things, but those are traditionally the top ones. And then there's Ayurveda, which is derived from India. It's a whole medical system derived from India. And it understands the energetic forces called tridoshas that influence nature and human beings. And if there's a strong connection between the mind and the body. And there's, lots of guidance out there, a lot of lifestyle guidance to improve health and well-being for folks that are in this medical system. A lot of it's herbal and dietary changes that need to happen. So again, following that lifestyle medicine type of approach to healthcare. And then homeopathy. Homeopathy was developed in the 18th century in Germany. And the thoughts were that the disease can be cured by a substance similar to the substance that caused the disease, essentially, like cures like. Likewise, they also use philosophies that a minimal dose is what you need to shoot for. So many of the homeopathic remedies are very, very diluted substances from the original substance to try to bring the body's chemistry back to a very homeostatic state. And so you'll see a lot of very natural diluted substances being used in homeopathy. And then there's naturopathic medicine. This was derived in the 19th century in Europe and may also incorporate some of the homeopathic medicine, but also usually involves manual therapies, exercises, often other conventional healthcare teams kind of partner with a naturopathic doctor or clinician, and they may couple on treatment prescription based on, the medication that's being offered, and then incorporate some of those lifestyle practices as well, including dietary, herbal supplements, stress reduction, exercise. So there's, again, you can see this overlap is happening with all these different medical groups, medical practices. And then lastly is the functional medicine window. And again, that's a patient-centered, scientifically based functional medicine, or excuse me, medical system. And again, those people, functional medicine physicians, as well as practitioners that support the physicians. There are some functional medicine certifications out there for folks like us. And so, they take into consideration the patient's genetic biochemical makeup, and they may direct their lifestyle patterns, whether it's eating habits or exercise habits or nutritional supplementation, into a direction that will most benefit their genetic code and the disease that they're trying to overcome. So far, this has been a lot of definitions and a lot of stuff, hopefully that clarifies some of the things that are, terminology that's out there for you. So you can see each one of these medical systems kind of overlaps just slightly. And when we talk about integrative medicine and rehabilitation, all these things kind of fall under that umbrella of integration and how you integrate different components of thought process into your practice of conventional care. So let's talk a little bit about the different types of components of integrative medicine. I'm trying to get my notes. Sorry, y'all. This is what happens when you're nervous too. So when we talk about integrative medicine, it's kind of broken down into overarching categories. First, there's mind-body practices, which we'll go into each one of these a little bit more depth. And then there's also natural supplementations. And so those are kind of the two major components of integrative medicine. And then inside mind-body practices, you're also going to find practices of the mind, movement therapies, and biomechanical therapies. So what are practices of the mind? Now, the one I'm giving you for the next couple of slides are basically the things that you're going to find out there with the most evidence-based research to support you in your practice for the best outcomes. It does not mean that there are not others out there that have evidence. It's just that they're the most prominent things that are out there that we all know that evidence-based is the best thing that we have going for us. And so we want to make sure that we're using these first. It does not mean that you can't use other types of practices, but I would highly encourage you to make sure it's evidence-based. So different practices of the mind would include meditation, mindfulness, guided imagery, mindfulness-based stress reduction, which is also a form of meditation, hypnosis, prayer, creative arts therapies. These are just a variety of different practices of the mind that you can integrate into your regular conventional care of treatment. So as far as mindfulness and meditation, the primary goal of meditation is to focus one's attention to control thoughts and reduce stress. Mindfulness requires a participant to bring their full attention to an object. You may have heard this before. Hopefully you're practicing this. According to John Kabat-Zinn, who did many, many books and studies and things on mindfulness, he defines mindfulness as the awareness that arises through paying attention on purpose in the present moment and non-judgmentally. Which, if you think about that, that takes a lot of energy to be present right here, right now, without judgment and on purpose. And doing everything you do for during the day is what we would like for people to get to do that. But even just a practice for a small moment of time can be practiced or integrated into a session. If you think about your rehab sessions with your patients, are you able to get them to focus on a particular activity for just a few moments? Without judgment of maybe something that has happened in the past, making sure that they're paying attention. If you want them to work on their gait, what does that feel like? What does that look like? Envision it into your mind. Be present right here. Don't think about falling last week. Just being able to integrate mindfulness. There's other types of meditation out there, and I'm only going to go through a couple of them, but there's the mantra meditation, which is based on a syllable or a word or a phrase that's repeated during the meditation and can be spoken, whispered. It can be repeated in the mind. And it allows the body to relax in a positive way and has been proved to reduce blood pressure, stress, anxiety. So just having that constant flow of movement through the body through a mantra. Then there's the body scan meditation, which is a very specific form of mindfulness that requires the practitioner to help the client focus their attention on parts of the body, or different parts of the body, or systematic approach parts of the body. There's different ones out there, so you kind of have to know what you're looking for and what purpose each one has behind them. Then there's transcendental meditation, which there's hundreds of independent research studies out there that found people who participate in transcendental meditation have increased in their calmness, creativity, energy, clarity of the mind, happiness. I guess just a little fact, according to the Cleveland Clinic, the transcendental, good golly, meditation doesn't focus on breathing or chanting like other forms of meditation. Instead, it focuses and encourages a restful state of the mind and thinking. And there's different types of practices that kind of fall under this. Even iRest yoga, if you're familiar with that certification, is a form of meditation that goes into this restful state of mind, but it kind of crosses over to some other things we can get into another day if you'd like. But those types of things are integrated into transcendental meditation. And then progressive muscle relaxation, that's something that I think a lot of KTs have used throughout the years, but it's a method to help relieve or reduce muscle tension, where you tense up a muscle group as you breathe in, and then you relax them as you breathe out. And you can work your muscles in certain orders. And when the body is physically relaxed, it will also provoke anti-anxiety, decreased pain, lots of different things. And so you can see how mindfulness can be used in different ways, but there's a lot of research out there about mindfulness being used in anti-anxiety, stress reduction, chronic pain, trauma, those types of things. And so I invite you to incorporate that into your practice if possible. Some other practices of the mind may include mindfulness-based stress reduction, which is a very specific type of mindfulness practice. It's an 8-week evidence-based program that offers intensive mindfulness training to assist people in stress, anxiety, depression, pain. It was developed by Jon Kabat-Zinn, who I mentioned earlier, using a combination of mindfulness meditation, body awareness, yoga, exploration of patterns of behavior, thinking, feeling, and action. It's a very specific program, and you have to be certified through this program to say that you're doing mindfulness-based stress reduction. So it's a very specific certification that you would get for that particular one. And then hypnosis. A lot of people don't believe in hypnosis. They think it's voodoo medicine, but there's a lot of evidence coming out that definitely supports hypnosis working for some very specific diagnoses. And again, with hypnosis, it's kind of like a trance-like state that you get into, where you heighten your focus and concentration. Hypnosis is usually done with verbal repetition and mental images that can make you feel calm, relaxed, and then also open to suggestions, which is where I think many of us clinicians would like to have the ability to control people's mind to do exactly what we want them to do so that they have success in their health and well-being, but that isn't what we do. But there are clinicians that are qualified in hypnosis to be able to do that. So we can have our clients be more open to suggestions so that they can cope with their pain or anxiety better, or there's been some proven effectiveness in irritable bowel syndrome, different side effects of chemo, some other mental health conditions like depression, anxiety, those types of things. There is some evidence being produced right now on weight loss and tobacco cessation in incorporating hypnosis into your care. So those are, there's a big wide open window there. Let's put it that way. And then some other practices of the mind, which you may not think a lot of these are for you, but they may be something that you can incorporate into your care. So lots of different forms of creative art therapies. So art therapy itself, music therapy can be incorporated if you play different types of music while you're doing your therapeutic routine. It can have different effects on the heart rate and blood pressure and outcomes of the modality that you're working with. Dance therapy, drama therapy, creative writing. So there's different types of creative arts that can be used. And basically, they're used to address mental and emotional development, behavioral relationship with the client, to be able to express themselves artistically and promote wellness and the unique personal reactions that their body has. So for example, if somebody is experiencing trauma and they integrate a positive music therapy technique into their therapeutic intervention of exercise, because you're treating them from chronic pain, they may have reduced symptoms because now they're relating this to a positive interaction with their body. And so there's lots of different forms that you can follow out there that follow this. But again, these are practices of the mind. Another practice of the mind is guided imagery. And this is where that the individual kind of explores visual images. A clinician may give cues. Initially, a positive image might be created to help the patient relax, like this beach scene that you're looking at here. If you think that that's a safe or relaxing experience, that may be kind of put out there for you to focus on and have that image in your mind. And sometimes the patient comes up with the image. And a lot of times, more often than not, the patient and the clinician collaborate on the image that they're focusing on. But ultimately, guided imagery is controlled by the person experiencing it. It allows them for a better sense of mastery, which can fuel and redirect change efforts. So if you have somebody that's going through behavioral change efforts, even if it's just learning how to walk again, or they need to lose weight, or they want to change their eating habits, they can visualize this state, this altered state of them, and it becomes something to talk about, and it works on the subconscious and the unconscious mind. And these images can distract from pain. They can distract from discomfort. They can give a feeling of warmth. People can cope with stress better. They are all kind of encouraged to be very descriptive and allow the client to use their senses to become more one with themselves. Imagery can be effective in all major physiologic control systems, including respiration, heart rate, blood pressure, metabolic rate, digestive system motility, and secretions. It could have an effect on cortisol levels, cholesterol levels, immune systems, mood, anxiety, depression. So there's lots and lots of information out there and how it can affect different systems. It can also be used as a form of biofeedback. Sometimes that terminology is kind of crossed over there. And so you can see how this can be used to regulate or self-regulate an individual. So moving right along, the next thing I'm going to talk to you a little bit about is movement therapies. Again, these can be crossed over into the different types of mind practices because they integrate different types of mindfulness into practice. I think a lot of kinesiotherapists get excited about this particular slide because these are things that we can relate to the most as movement therapists. And so let's just talk about these for just a moment. And so the first one there on the list is exercise. Let's just say exercise is repeatedly shown to reduce risk and development of progression of diseases, illnesses, mortality over and over and over again. There's lots and lots of research out there that physical activity is applied when it's applied to recovery, to illnesses, deconditioning, whatever, it can be recognized as a preventative and medicinal intervention. So, there's tons of research out there about how exercise has a physiological impact on the body and outcomes for disease, illness, and otherwise. In 2007, the American College of Sports Medicine and the American Medical Association joined forces with the Office of the Surgeon General to implement an exercise as medicine campaign. I'm not sure if all of you remember that time frame. I remember it well. I was invited to go up to the press conference up in DC. It was really, really cool and awesome to be there the day that they announced that. But the Exercise as Medicine initiative was implemented to encourage practitioners to promote exercise and physical activity for treatment of disease and preventative health measures. And basically, physicians were given prescription pads, and on those prescription pads, it had an exercise prescription on it, even if it was just to see your local kinesiotherapist or other practitioner to get an exercise program or prescription, because they knew that exercise was definitely the medicine that they wanted to start prescribing to have a benefit for that individual. So, definitely this is something that you all can play a role in here, but some other things are things like Tai Chi, which is a form of martial arts derived from ancient traditional Chinese practice. And it's a series of slow movements patterned with breathing, and it fosters the chi within the body. If you don't know what that word means, chi, it just basically means energy. To promote harmony of the mind and the body. And I know that there was a Tai Chi lecture earlier this month, but there's tons of information about Tai Chi, but its most prominent applications are for fall prevention, osteoarthritis, Parkinson's disease, chronic obstructive pulmonary disease, and also for cognitive function. So those are just some very prominent research studies that are out there. Now, on the other hand, there's also Qigong, which is another traditional Chinese practice, which involves movement encompassing affirmation, breath work, meditation, and guided imagery, which we spoke about just a little while ago. It's proven to be effective to improve exercise capacity, to decrease symptoms of depression, to reduce inflammation. It can help stabilize blood sugar. Of course, that's an exercise component a lot of times, but because it helps with other processes in the body, it helps stabilize blood sugar. It can help reduce musculoskeletal pain, and it can improve the quality of sleep that an individual has. A lot of that is affirmation and breath work and calming the body and being able to relax the body. So Qigong is out there. And then there's yoga, which a lot of people are familiar with yoga, another mindful movement practice that encompasses stretching, strengthening poses, meditation, and breath work. Yoga is proven to decrease chronic pain, stabilize blood pressure, reduce stress, improve balance, improve breathing. It is said to improve spine health and mental health, blood flow, sleep patterns, strength and flexibility. So the list goes on, but there's a lot of research out there about yoga. There are several different types of yoga out there. Some are a little bit more beneficial for certain things than others because it depends on the type of yoga it is. There's a very meditation strong types of yoga, like I had mentioned earlier, which is I rest yoga, which is not, it's just based on meditation. And then there's very aggressive, like Ashtanga physical yoga out there. So there's different types of yoga that somebody can come up, introduce to their practice, depending on what they're trying to achieve with their clients. Pilates is another mindful movement developed by Joseph Pilates in the 1920s. He did originally call this type of modality controlology, which was basically the science of control and incorporating different components of gymnastics and boxing and wrestling, where he really focused on the core strength and the spinal alignment to improve overall fitness and coordination of the body, mind, and spirit. And so there's lots of research out there to be effective by using Pilates in low back pain to improve lumbopelvic rhythms and also just strengthen the core and pelvic floor muscles. So if you have anybody with any type of bladder control issues or things like that, you may want to incorporate some Pilates techniques there. And then the Feldenkrais method, that's been around for a long time too. That was developed by Moshe Feldenkrais in, I believe, the 20s. I could be wrong about that. I don't have that written down. But anyway, basically he incorporated gentle, mindful movement principles based on physics, biomechanics, psychology, motor development, and incorporated martial arts in there a little bit too. To reconnect the self with how the body is moving. And so really just that body awareness is really taken into consideration in the Feldenkrais method. And this has been proven to relax the spine, decrease chronic pain, stabilize balance, improve quality of life, promote mobility and confidence. A lot of confidence because of body awareness comes with Feldenkrais method. So think for a moment how you can incorporate different components of any of these mindful moments, or excuse me, mindful modalities into your particular practice. I'm going to jump ahead to the next thing, which is biomechanical therapies. And you've probably seen all of these biomechanical therapies, not sure how they really work for you or apply for you, or are they really alternative? Please note that these are complementary services, and they are highly researched. Some of them are more researched than other. For example, acupuncture is probably the most researched complementary modality that's out there. It's a form of energy medicine. It shares a conceptual framework like Tai Chi and Qigong, where the chi that runs through your body, the energy that runs through your body, or the life energy, sometimes it's called, runs in channels through your body of meridians. And then any obstruction to that energy pattern can disrupt the chi. And so what acupuncture does is it uses needles, or in the case of acupressure, might use the needles or the pressure points along the meridians to help reestablish patterns of chi that return the body to a kind of a state of homeostasis. And it's been proven to be effective for pain, both musculoskeletal as well as neuropathic pain, different headaches, nausea, vomiting, and it's being used for other things more effectively now too, is like anxiety. Lots of acupuncturists are doing it for anxiety and some other symptoms. You know, some of the research is still being proven for some of those other things, but those are the top ones. Then there's osteopathy, which was founded in the 19th century, I think by Dr. Andrew Still, where they concentrated on the manipulation of the spine. And there's moderate evidence that manipulation and mobilization of the spine can reduce pain and improve function on many different systems of the body. And so that's where osteopathy comes in. Then there's also chiropractic care, which kind of overlaps into osteopathy, where there's manipulation of the spine, but they also generally use other modalities like heat and ice, electric stim. There may be nutritional counseling. Chiropractic services are generally used for spinal pain, as well as headaches, joint pain, and other soft tissue injuries, depending on where the soft tissue injury is, and just trying to realign the structures of the body itself. Massage therapy is out there, and there is a difference between medical massage and spa-like massage. I'm not sure what the right term is for that, but there is The term massage in general is defined basically by the pressing and the rubbing and the manipulation of the skin and the muscles and the tendons and the ligaments to aid in relaxation and recovery of whatever injury or illness or tension that may be being experienced by the individual. In medical massage, often they realign those structures, those soft tissue structures, to help relieve pain, relieve stress, anxiety. It may help in the alignment of the chi as well, depending on the pressure points that are being used. And so it can be used in lots of different ways. I've seen it used for neuro patients and oncology patients for different types of relaxation and symptom management in the medical field. And then Rolfing, that's a term that a lot of people have forgotten about, but it's basically a type of body work which uses like deep manipulation of the body's soft tissues to realign and balance the body's myofascial structures. And so those of you who have had some intense myofascial training, you may have learned Rolfing during that training, but it's something that you can integrate and really realign the body's soft tissues. And then out there is biofeedback. Lots of different techniques of biofeedbacks out there. And basically in biofeedback, there's techniques used in making the unconscious or the involuntary bodily processes like heartbeats or brain waves, and allows the body to sense that and hopefully manipulate them by the conscious mind. So there's different types of feedback out there. Some people use EMG, there might be heart math, there might be different neuro pathway biofeedback out there. And so there's different types of biofeedback that folks are using in the field. You can use a very simple heart rate variability method in your exercise integration and therapeutic techniques, but it is considered biofeedback. And then regenerative medicine. This is more on the forefront, the cutting edge, I guess, although it's been around for a long time. It's kind of a branch of medicine that's concerned with developing therapies that regenerate or replace cells that may be diseased or defective, or tissues or organs that may be defective, and establish function and structure. It could be stem cell therapy. It could be transplantation, like a liver transplant or something. It could be the use of plasma-rich therapy. I think some VAs are using PRPs, plasma-rich therapy treatments to help increase blood flow in certain areas like arthritic pain and things like that. And so you're going to see these therapies being integrated into rehab all over the place. All right, let me go ahead and move along to other natural products that also are integrated into integrative medicine. And so under the natural products umbrella, you're going to see nutrition, dietary supplements, as well as essential oils. There's a concern that various foods can cause inflammation and lead to disease states. That's why the anti-inflammatory diets were developed. And one thing to consider is whether an anti-inflammatory diet is proper for that particular individual. Another area that comes up is the excess free radical production that may be causing tissue damage or inflammation in the body. So, those things could be considered when evaluating somebody with some of these chronic diseases and or inflammatory type diseases or illnesses. It's thought that certain types of foods are high in antioxidants and may protect against free radicals and damage, like fruits and vegetables and such. There's also an array of dietary supplements and herbal supplements that have an effect on inflammatory responses, healing responses, and normal functions of the body. For example, somebody might take saw palmetto for their prostate health. They might take echinacea for immune health. They might take turmeric for inflammation, or integrate all of these things into their diet itself. Like, there is natural turmeric out there. If you have never had it, you should try it. It's really kind of sweet and yummy. And you can just chomp on an echinacea plant if you want. I don't encourage it because they're bitter, but you could integrate them into your daily routine. And so there's also essential oils. A lot of times these are used in a aromatic situation, but they're concentrates that are derived from plants. And that's the easiest way for me to put that. They can improve physical, mental, and spiritual well-being depending on what you're using. For example, many of you have probably seen lavender essential oil out there, and that can help relax the body. It's often infused into different materials that help people relax. There are many uses for essential oils, and they can include stress, anti-anxiety reduction, pain management, nausea. The only drawback about essential oils at this point is that there's currently no Food and Drug Administration monitoring going on in essential oils. So the concentration of the oil itself may vary depending on the product. There has been some stuff that have gone on in the community over the last couple of years about some things being defective. So just kind of know where you're getting your product from and how concentrated the essential oil is, and how it can be used into your practice. So that kind of ties up a lot of the different types of integration modalities that you could use into practice. But there's also a huge economic benefit to incorporating some of these practices into conventional medicine. There is a huge rising cost of healthcare going on right now. What's being found is those systems that are integrating CIH is finding a greater economic cost benefit, especially those who are integrating a lot of the lifestyle components of the medicine into practice. In 2018, according to the CDC and the government, the US national health expenditures topped over $3.6 million. And about 17.7% of that was just, things that we do, of the gross national product. It was 17% of the gross national product was of health expenditures. That was in 2018. In 2020, we topped over 19.7%. Trillions and trillions of dollars being spent on healthcare, yet we are also one of the sickest nations in the world based on our health, our longevity, our mortality rates. And so what we need to do as a healthcare field is integrate more lifestyle, more regular practice, more self-centric practice, integrating some of these techniques that can be done, without additional what's the word I'm looking for? Additional resources like equipment or things like that. Teaching people how to do a Tai Chi, or changing their diet, or using some biofeedback for stress control. Whatever it is, integrating some of these things that don't cost as much to integrate into regular living, so that it can drive health care costs down. So how about for kinesiotherapists? Obviously, I think the easiest place for us to move is the mindful movement modalities. If you haven't been certified or trained in any of those movement modalities, I definitely would like to see many of you get trained in those things: Tai Chi, Qigong, yoga, any of those things. There are certifications that are out there, and we can go into those a little bit at some point if you'd like, but also integrating like guided imagery and mindfulness into your regular clinical treatments is totally appropriate. And of course, there's different trainings out there that you can go to sharpen your skills in those areas. There's different mantras that you can use to integrate into your practice. Having a firm understanding of nutrition is really helpful, and how that has a physiological effect on your patients as you are treating them with the different illnesses, diseases, things like that. Health coaching, which I did not touch on at all, but health coaching is a huge component and definitely part of our scope of practice that we can be integrating into our sessions. Maybe you're a dancer, you love dance. You can definitely integrate different forms of creative dance into your practice. You can also get certified in different things, but those of you who are dancers out there, this is something that you can definitely do with your pain patients, mental health patients. It definitely diverts the mind in a very positive, rehabilitative way. And then again, there's always health education and behavior change, which I think we've always been very good at as a profession. And so that kind of starts wrapping up. I do have some references here for us to look at, but I used a lot more than this. But I do want to just leave a couple minutes here at the end for any questions that anybody wants to talk about, or anything that maybe I missed that you'd like to see more on at another date. So thank you all.
Lori, I have a question for you.
Yeah.
You listed a lot of different certifications that you think, are really helpful in a lot of different ways you go. If you were to pick, one or two that you think every KT should absolutely have, or, if you were talking to a bunch of new grads and you were going to say, before the end of the year, make sure you get these to strengthen, what would those be?
Yeah, good question. I think the way, of course, I'm very limited in my knowledge. I know a lot, I guess, comparatively, but the way I see things and where our scope of practice sits right now, you already own some of these modalities. I think, some of the movement modalities are very easy for kinesiotherapists to do. So getting trained in Tai Chi, Qigong, yoga, one of those would be very beneficial to you. The other one that I'm thinking would be really beneficial would be health coaching. And I'll just say this too, know your organization's expectations. If you planned on getting a certification in yoga, know that like the VA does not accept just any old yoga training. Okay, there's lots of different trainings out there. They actually want you to have Yoga Alliance training and be a registered teacher with either 200, 500 or higher hours of training. If you wanted to get health coaching, you need to be trained in the VA by National Board of Health and Wellness Coaching. And there's several different coaching programs out there that fall under that, but you actually have to get certified by the National Board of Health and Wellness coaching certification. So I think it's really beneficial. I can go on and on probably of other certifications, but we already own movement. So, stay with what you know first and then build on top of that, I guess my advice would be, if that helps, Kathy.
It does, absolutely. This is amazing. If anyone else has questions, you can unmute yourself and hop on, or you can ask it in the chat.
Lori, this is Bridget.
Yeah.
Do they find that some of these modalities get reimbursed for, or are a lot of them out of pocket?
It depends. It really depends on what it's being done. So say like chiropractic care, massage, biofeedback, even health coaching is being reimbursed. I think that the insurance companies are starting to recognize some of these other things as more, like I said earlier, like they're being recognized as more mainstream than complementary at this point. So a lot of insurance companies are starting to pick up and say, oh yeah, we'll cover a certain amount of sessions of yoga or Tai Chi. It's just got to be billed properly. In the VA, we get paid a little different. And those of you who are in the VA, you know that we get paid a little differently. If a veteran participates in 10 or more sessions that are considered on the list 1 or 2 modalities, which basically are ones that I covered today, then the VA, the local VA gets more money. And so that could be beneficial for for your organization as well. But I do see a lot of insurance companies picking up on a lot of these other things. Definitely the different ones that, you know, I mentioned: acupuncture, biofeedback, chiropractic care, massage. They're definitely picking up on a lot of those complementary services.
Is there one overarching group, like, you know, we have, you know, CDC or whatever that oversees integrative medicine?
Yeah, so the national, I mentioned it earlier. Let me just make sure
Yeah.
I say it correctly to you.
Complementary medicine, something.
Yes, it's a governmental agency, and it regulates, and it also does research.
So that's where the reimbursement would come from, probably through the insurance company.
Well, yeah, they do a lot of the research. So it's the it stands for NCCIH, stands for National Complementary and Integrative. What does it stand for? Help me out, people.
I don't know.
It's yeah, National Center of Complementary and Integrative Health. Yes, nccih.nih.gov. So it's a component of
NIH.
NIH. Yeah. Mhm.
All right, thanks.
Yeah. Any other questions out there? I know we're right at the 1:30 line. If anybody has any comments or questions they'd like to share, I'd be happy to field anything via email for sure and collaborate with you.
I do just want to say that it is important, if you're going to say that you offer a service, that you are actually trained in that. So really important to get a nationally recognized credential before you say you're already doing it.
Thank you, Ruth.
I'll put up a list of all of these and links, and I'll try to be able to designate which ones you can get reimbursed for, which ones maybe out of pocket, which ones, you know.
Yeah, and I think, Kathy, it's interesting to, you know, some of these things cross over into the well-being world. And so based on, you know, what you're trying to accomplish, if you're actually treating versus just offering a service of well-being is part of how people can get reimbursed individually. Mm-hmm.
Well, and I think, you know, obviously there's a large group of KTs that are in the VA, but if there is, you know, some that are private practice or maybe transitioning from VA to private practice, a lot of these are going to be really necessary to have.
Absolutely.
Yeah, that's terrific. This is wonderful. Thank you so much for your time. I really appreciate it.
Absolutely.
Tremendous information. And again, we'll have it up on the website so you can go back and reference it. And with Lori's permission, we'll also put her email so you can contact her with any additional questions you may have offline.
Yes.
Fantastic.
Thanks, Laura.
Thank
Yeah.
you so much.
Thank you. Y'all take care.